Dr. Shushma was having sleepless nights in August 2020. When hospitals were reeling from the COVID-19 crisis, the medical officer at Porutuna Health Center in the Wayanad district of Kerala was worried about another threat: flooding. She had her reasons to be worried. When we visited Dr. Shushma's health center after the 2018 floods, we found it severely damaged. Patient records, medicines, vaccines, and hospital equipment were all destroyed, and health services to nearly 30,000 people interrupted. It took them several months to rebuild the facility. Though they had incorporated flood resilience measures, it was still unknown if the center would hold up against severe rains. Hospitals are perhaps the most important buildings in any community, especially during calamities as people turn to them for first response. The photos that you see here are of healthcare facilities hit by extreme weather events, rendered useless and ceasing to function at a time when they were most needed. Let me be clear about one fact. The climate crisis is a health crisis. It threatens our air, water, food, shelter, and security, all the basics on which human life depends. This is not a crisis in the future. We are already in it. Severe temperatures, heat stress, excessive rainfalls and floods, and more frequent extreme weather events are all evidence of this. India experienced extreme weather events on 241 out of 273 days between January and September this year alone. It claimed over 2,700 lives, damaged up to 1.8 million hectares of crop area and more than 400,000 houses, and killed over 69,000 animals. Extreme weather events not only threaten people's health, but also healthcare's own infrastructure and capacity to respond. I work at the intersection of climate, health, and justice. And for many years, I have been tracking health systems' response during and after a major extreme weather event or crisis. From my experience, I can tell you that our health infrastructure is not designed to cope with multiple stressors. Let me explain this. Tell me, were you able to access healthcare for anything other than COVID-19 during the lockdown? Until it was pointed out, there was no plan for those with chronic illnesses. How people would access treatments for blood transfusion, chemotherapy, or dialysis was not thought of. Pregnant women and people with mental illnesses faced treatment interruptions. There were delays in diagnosis, and essential medicines became unavailable as the entire system focused only on the pandemic. People's desperate cries for help as they were looking for hospital beds and life-saving oxygen further exposed the gaps in the Indian healthcare system that could not step up speedily. In this climate reality, if you think that COVID-19 was the worst crisis posed to our public health systems, then think again. Climate change will make COVID look pale in comparison. So the key question is, how do we make our health systems climate resilient so that they can withstand the impacts of extreme weather events and continue to provide care? Well, there are a few things that needs to be done. Firstly, in this changing climatic landscape, we need to rethink how we build our hospitals and take into considerations the climatic vulnerabilities of the location. For example, a very simple measure. Power backups for hospitals cannot be in the basement if the area is flood prone. 18 people who were on critical life support died in a well-renowned hospital during Chennai floods because the flood waters damaged the power units in the basement. Secondly, We need to have emergency preparedness and disaster management plans in place for every hospital. Third, we need early warning systems that can predict disasters. Fourth, we need a trained healthcare workforce and effective coordination with state agencies and civil society organizations. Fifth, it's absolutely important that our hospitals and cold chains are powered by decentralized renewable energy to ensure access and continuance of services even when the grid fails. And last but not the least, we need finance and investment in the public health systems in this country. Now, these measures may sound like a faraway dream, but when implemented, they can avert crises and save lives. And Dr. Sushma's story is proof of this. In preparation for the 2020 rains, her team looked out for early warning signs from the district authorities. Rapid response teams were mobilized and volunteers were trained. Camps were stocked up with medicines. People living in flood-prone areas were identified and shifted to safer zones. The flood resilience measures in the newly built hospital helped in protecting it from water stagnation and damage. And as a result of all these measures, there were no adverse impacts, and the health center continued its operations uninterrupted. Like this small family health center in Wayanad, climate and health leadership in India is coming from some really interesting places. Chhattisgarh has solarized over 1,400 health centers and pledged to attain 100% solarization to ensure access and reliably manage cold chains for medicines and vaccines. Post-2018 floods, Kerala is now building flood-resilient health centers to ensure continuance of services even during excessive rainfalls. Assam has started boat clinics that provide health services to thousands of people living in remote islands far away from the reach of regular health centers. Doctors for You, a non-profit of more than 3,500 frontline health responders, is focusing on flood and disaster management and emergency response, especially in small towns and rural areas. These inspirational initiatives give us a glimpse of what is possible. However, the scale of challenges that we face today requires each one of the 70,000 odd health centers in India to adopt similar measures. And for that, we need to significantly ramp up public investment in health, way more than 1% of the GDP that we spend now. Let's also remember that we need to frame policies keeping in mind that human health and planetary health are deeply interconnected. It's impossible to imagine healthy people on a planet where air is not clean, water is not safe to drink, and food is not nutritious. India can become a climate leader only if we reimagine our health systems. Hospitals cannot be seen as places for just responsive care. Rather, they should be the foundations for preventive care. It's time that our health systems become climate resilient and sanctuaries for communities. And in any crisis, they are the first ones to respond and the last building standing. Thank you.